Right, back with you tonight here on In Focus, Newzroom Afrika, channel 405. Some unfortunate news coming through of the passing of some runners. The Hollywoodbets Athletics Club confirming the passing of its runner Mzamo Mthembu, who collapsed while taking part in the Comrades Marathon yesterday. The club states that Mthembu experienced complications along the route and was taken to Westville Hospital, where he passed away. The ultimate human race made its return after a 2-year hiatus, with its 95th edition being marked by a race from Pietermaritzburg to Durban. The Hollywoodbets Athletics Club has meanwhile sent its condolences to Mthembu's family, saluting him as a warrior. Meanwhile, 47-year-old Pretoria athlete, I beg your pardon, also tragically passed away during the down run this past Sunday. Joining us now is sports scientist Dr. Ross Tucker to explain a little bit more. Dr. Tucker, good evening, and thank you very much for your time and for joining us up here on In Focus. Is this a prevalent occurrence for runners, especially in such a grueling and such a demanding race?
Fortunately not, no. It's quite rare. I mean, it's obviously extremely sad when it happens, and it's shocking when it happens, because you don't certainly go and do an exercise activity like Comrades, which you associate with fitness, and then anticipate that someone young and otherwise healthy might die doing it. So it really is shocking, and condolences to the family and the loved ones. But luckily it's quite rare. Unfortunately not zero risk though.
Yeah.
So there is quite good data on this, and probably it affects between 1 in 50,000 people, young people who have these sudden unexplained or unexpected deaths during exercise, and everyone sits up and takes notice. It's tragic, of course. And what's probably in play here is a couple of things. One is, when people are active and regular exercises, their overall risk is lower of any cause of death, especially cardiac-related deaths. And we don't know what the cause of these two was, but this is the most common. But unfortunately, exercise in some people, when they have a predisposition or some underlying condition, potentially a previous illness or a viral infection, exercise can be the catalyst or the trigger that causes this to happen, even though otherwise it would be considered to be a healthy activity.
And are these complications manageable? Is there a way of managing them in certain instances, maybe if they've not gone too far, as we probably are looking at in this particular instance?
Some are, some unfortunately not, and often what they say is that sudden death is what they call the sentinel event. The first indication that there's a problem is often a person has a fatal incident, and hopefully that's not what's happened here, but it depends on the cause. So there is data that shows, for instance, that about 10% of these cardiac or sudden unexplained deaths can be explained by a previous infection, the flu, having a viral infection in the months or the days leading up to doing sport. Now, obviously, that's something we can control. It's the reason that many medical practitioners will say, don't put yourself through the demands of exercise when you've had a viral infection. So that one can be controlled. Coronary artery disease, certain conditions that affect the heart, they can be tested for and looked at. Others, unfortunately, not. The best advice you can give to someone is just be very aware and pay very close attention to any issues that develop when you're exercising. If you experience tightness in the chest, shortness of breath, chest pain or arm pain, dizziness, loss of consciousness, anything that you might otherwise brush off and say, I'm sure it's just a once-off, that could be the thing that gets your attention and potentially saves your life. So that's why people have to really pay attention to anything that goes slightly wrong during exercise, and then you see a doctor and you have yourself assessed and tested.
Yeah, I mean, it's really in the realm of speculation at this particular point, because we don't know exactly the full details, but I'm just kind of thinking and letting my mind go a little bit further to say, of course, the past 2 years we have been dealing with a particular virus that has affected our respiratory systems. Could that kind of a virus or that kind of an infection have this kind of impact?
It could, yes, unfortunately. And as I mentioned, we've got some data that shows around 1 in 10 cases like this can often be attributed to a previous viral infection, because then what happens is the virus can affect the heart, either the muscle of the heart or the outer lining around the heart. And I remember when COVID began, there was quite a lot of research been done into what was happening to young athletes when they got COVID. and there was certain signs that some of them, not everyone, but some athletes with COVID would show persistent inflammation, and it would affect the heart afterwards. So it is one of maybe a handful of possibilities, and it obviously now remains to be determined whether that's the case here or not, and that's something that the medical examiners can explore with these unfortunate cases.
Yeah, you spoke of checks and tests maybe that you could do pre-race. Is there something that you could possibly ask for and check for when you go to a doctor, when you know you're about to engage in such a grueling kind of endeavor?
There is, and obviously you don't want to alarm people to the extent that now they're going off and being assessed every single year when it's not necessary. Unnecessary testing can be just as bad, if not worse. But as we get older, unfortunately, reality is that these risks go up. And so for people over the age of about 40, once every 3 to 5 years, a regular stress ECG where they can look at the function of the heart, they can ask certain questions around whether those electrical signals that control the heartbeat and make it pump are working the way that they should. They can look into whether your blood flow to the heart is normal. So those are tests that you can have done at a physician, stress ECGs. Other than that, a regular physical exam every single year is always recommended. And then, as I mentioned, just paying attention to your symptoms. It's obviously hugely recommended that people exercise, but when they do that, just be aware of how you feel and make notes, and don't ignore things that potentially indicate that something might be wrong. Rather see the physician when that happens in the beginning and try and head off the potential for things to get worse.
Dr. Ross Tucker, appreciate your time. Thank you very much for coming on and your intervention here this evening. That is a sports scientist there, Dr. Ross Tucker.